Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning will begin on Milwaukee Health Services Incorporated, an independent, nonprofit, federally qualified community health center that's committed to removing barriers and improving health outcomes to disparities among racial and ethnic communities. My first guests are Dr. Aronica Williams, who's the Chief Medical Officer at Milwaukee Health Services Incorporated, and Babette Honore. She's the Director of Community Engagement for Moline Healthcare. Good morning, ladies.
Good morning.
Thank you both for being here. And we do have you here to remind viewers of some of the important services that are offered at MHSI, but there's also this big community event that's specifically set up for mothers-to-be that's taking place on Saturday, May 12th. It's a Luau Lullaby baby shower sponsored by Moline Healthcare. So I'm excited for you guys to tell everybody about it.
Awesome. Well, it's a wonderful opportunity for Moline Healthcare and Milwaukee Health Services to come together again. You know, we do a lot in the community. We do a lot of collaborations, and so this was another opportunity. During our holiday giveaway, we were talking about what's next. What do we do next? Let's do something for mothers. And so around the time of Mother's Day, actually the day before, we're hosting the Luau Lullaby baby shower. It's a mouthful, right?
Yes, it is a mouthful.
But we want to make sure that this collaboration that we continue to forge is something that our patients, but also the community is able to benefit from. And so this is a citywide effort with our two organizations.
It is, and I don't know if you remember, but we made the announcement on your show in November of last year that we were going to be doing this citywide baby shower. And you might wonder why Luau Lullaby. And the reason why we decided to do that is so that we can give an experience that it will be so enjoyable and so unique for, you know, moms to be.
And you know, of course, sometimes with being a mom, that comes with a number of different challenges, especially being a new mom or for patients in our community who may not have access to a lot of resources. As Babette said, we want to make sure that those ladies feel pampered like the gems that they are, especially around Mother's Day. And so we want to make sure that they are getting all of those services. So we will be pampering them on May 12th.
All right, and it's just really going to lay the groundwork so they'll know what Mother's Day is supposed to feel like, right?
That's right.
Especially the new
moms. And a baby shower. I mean, you know, for that precious one that they're carrying.
Yeah, and Babette, you asked if I remembered, of course, and that's why I said we'll get you back here to talk about it in detail. So I am happy to have you both here to give out all the details, and everybody watching, I really want them to help spread the word for those mothers-to-be, and it doesn't matter if you're, 3 months pregnant versus 9, just come on through. It is free and open to the community, and it's happening at the MLK Heritage Health Center, which is at 2555 North Dr. Martin Luther King Drive from 10 until 2 that day. Talk about, if you would, Babette, the importance of this partnership you have with Milwaukee Health Services.
Yeah, our partnership is even more than an event. We, on a daily basis, have members that are ours in Moline Healthcare that are patients of MHSI. So that partnership is very deep. We look to ensure that we're giving good quality care to those in need. And that good quality care we know is taking place at MHSI. So our partnership is critical in that respect. So it's more than an event. It's really a sharing of knowledge that's going to go on with the moms, and I think you can probably explain that a little more better than I can, but we'll be sharing that knowledge so that they know how to care for themselves while they're pregnant and for that baby to be. But there's other services that Milwaukee Health Service Inc. also provides that really takes care of our members holistically.
Yeah, and so what I'd like to do is really give a rundown of what participants can expect from this event. You've got Dr. Patricia McManus, who of course is the Health Commissioner for the City of Milwaukee Health Department, who's going to be there discussing prenatal care as well as postnatal care. Let's talk about the importance of that in particular?
Well, for a number of patients, especially those in lower socioeconomic and disadvantaged communities, just access to care in general. So if we're just talking about access to care and getting to care for patients, we want to make sure that we are emphasizing that care is needed early for chronic diseases, for preventive care, and then of course for prenatal care, because the education that goes on is so vital to moms, but also to that baby that's growing inside mom, right?
Yeah.
And so Dr. McManus will be talking about the importance of prenatal care. We'll be focusing on the importance of diet, certain things that, you know, would harm a baby, like smoking. So smoking from the mom's perspective, but also smoking in that environment. The importance of dental care, right? The importance of fatherhood, right? Because obviously we want to make sure that that family unit is as supportive as possible. And we know that every situation is not perfect. Every pregnancy is different. And so we also want to make sure that participants understand what's going on in their bodies. But if they have a question, those warning signs to look out for, when they need to call their provider and say, hey, this is happening, and to develop those relationships with their providers where they feel comfortable in doing so, right?
Yeah.
So that's all during those, you know, several weeks that that baby is growing. But then after the baby's here, what to expect? We need to talk about postnatal care and talk about safe sleep, because we know that a lot of infant deaths are due to improper sleep environments. So just even emphasizing, okay, what's the right position? No co-sleeping, all of those different things that need to be reinforced, you know, at every single visit. So when baby gets here and there's so many different things going on, you know, those things have been deeply ingrained and taught. You know what I mean? So we want to make sure that we're providing all of that vital information to supplement what the providers are doing at those frequent visits during that prenatal time.
Yeah, folic acid, calcium, iron, all those things, so important to mother-to-be. And I mean, you have children, so this is also an opportunity for women to kind of come together, network. There will be women there who have had kids before, and they'll be able to kind of, you know, share information and maybe even exchange numbers and say, hey, if you have any questions, give me a call. But what are some of the things you dealt with that were a little, you know, that stood out from, you know, the norm?
Thank you for asking that question. Both my kids, I had different types of medical issues. One, I had gestational diabetes. The other one, I had preeclampsia. And both of those are, preeclampsia is high blood pressure. Gestational diabetes is high sugar. And so both of those have very big impacts on the baby. And so it was really vital that I had my doctor visits so they could monitor me. They diagnosed it. They knew what was going on, so that all along the way as I had my visits, they could tell me how to care for myself and care for the baby. I think your point is really well taken, that at this baby shower, women that have had babies like myself, we can nurture and mentor those that are pregnant.
For the first time ever.
For the first time ever, and help them to know it's not a scary thing. You know, if you got a pinprick your finger, that's okay. You know, it'll be all right. It's for the good for the baby. I also wanted to underscore breastfeeding and how that's a topic we're going to be talking about. My daughter just had a baby, so I have my grandma. I'm a nana. I'm a nana.
Congratulations.
Thank you. And she was very determined to breastfeed for his first year of life, but she had a lot of support from women that told her it's okay if this happens. The baby will tell you when it's time for certain
X, Y, or
aspects,
Z.
right? So, and I think that that's another thing that we can, especially African American women, we can help each other to understand that that's great. You know, there might be challenges with breastfeeding, but it's well worth it.
Yeah,
And isn't what the village is all about? though?
Yeah.
Yes,
Right,
it is.
right.
It takes a village on
Yeah.
so many different levels.
Exactly.
So with some of the things that she even mentioned, Milwaukee Health Services Incorporated, you guys offer the WIC program,
Yes.
which of course provides supplemental food and nutrition for pregnant mothers and breastfeeding women. So if there's someone out there who would be interested in seeing if in fact they qualify for WIC, they can just stop by your facilities and go through the footwork, right?
Yes, absolutely. So they can, of course, make an appointment, but anytime someone steps foot on our campus, we try to make sure that we get them what they need. So if it is, oh, I need to see someone in WIC, we make sure that we connect them appropriately. To your point, we do see the entire patient. So we have family medicine doctors who have, as a family physician myself, I'm trained in OB. I don't do OB any longer, but we have providers who do still care for patients who are pregnant in the family medicine department, in the women's health department. So we're trying to make sure, and after that baby is born, we see them in the pediatric department and tie them in with the WIC department so that they're able to make sure that they have access to those resources. And so I think at any point, just the whole overwhelming aspect of being pregnant and what that could mean to someone, what's happening to their body. We don't want that to be a deterrent from them getting the help that they need. And so once they get there, we find a way to get them what they need, which is awesome.
Yeah, and MHSI is a one-stop shop, and that's what makes it really special. People don't have to make appointments here and there. You can make all your appointments and make it happen in one stop, so that's so important. And of course, there are 2 locations. So we talked about this baby shower being on King Drive,
Right.
and then of course you have your Silver Spring Drive location as well.
Right, 82nd and Silver Spring. One of the things that we didn't underscore is that all are welcome to the baby shower. Also, mothers who have just delivered and their babies are newborns to 3 months. And so that's an opportunity for those new moms to get surrounded by that village of support, because resources will be available for them as well. So right at that time, it's important that the breastfeeding is encouraged. One of the things that Babette was saying is that, you know, with her daughter, having that environment where there's always someone saying, it's okay, it's okay, it's okay. And so for those new moms, the safe sleep and those things that we were talking about, but also with the breastfeeding and letting them know this is a safe space and it is indeed okay.
Yes.
So what's most important right now, and is for everyone watching, they want to know how in fact can they get signed up and be a part of this big fun event, which I'm happy to say I am hosting. So what's the guidelines to follow?
Well, you can RSVP to Pamela Clark. She is at Milwaukee Health Services. Her contact information is area code 414-267-2655. Again, that's 414-267-2655. And she'll be happy to get people signed up. And so the word is already getting out there, but there's still space available. And like we said, we want to be bursting at the seams. So we're welcoming, you know, whoever would like to come.
Yes, and
we'll make space available.
your website address for more information as well as mhsi.org. And I wanted to also mention that entertainment will be provided by DJ Cheerio and the hilarious Kelly Kells. Now, Kelly Kells is a mom, so I can only imagine the jokes she will come up with, you know, being a mother, really helping them to kind of laugh at all the things that will happen or have already happened during the pregnancy, right?
But we also have our premier sponsor, of course, is Molina, but we also have the firefighters who will be helping kind of pamper and serve the women. We also we also have some sponsorship with Aronica Healthcare and also the African American Breastfeeding Network and also the United Way. So this indeed is a wonderful collaboration between a lot of organizations, and we want to make sure that our patients, our community, is benefiting from the hard work that these organizations are doing behind the scenes.
All important stuff, and I thank you again for coming by and sharing all the information with us. I did want to also just quickly mention that Milwaukee Health Services Incorporated is offering digital mammograms and cervical cancer screenings for uninsured and underinsured women. Again, give Pam Clark a call at 267-2655, and I thank you ladies so much for stopping.
Thank you for having us.
Always a pleasure. Dr. Aronica Aronica Williams is the Chief Medical Officer at Milwaukee Health Services Incorporated, and Babette Honore, she's the Director of Community Engagement for Moline Healthcare. Moline is again the sponsor of the Luau Lullaby Community Baby Shower happening Saturday, May 12th from 10 till 2 at the King MLK Heritage Health Center. Lunch, entertainment, and with funny Lady Kelly Kells and gift bags. So definitely make sure you come along for the fun. When we return to Our Issues Milwaukee, we'll find out more about Milwaukee's free and local food bank, Hunger Task Force. We'll tell you how you can help them stamp out hunger and a whole lot more right after this.